core principles of treatment, these were things that were highlighted by the APA guidelines and also by a few borderline experts, such as Glenn Gabbard. I've kind of put together an amalgamation of both. These include things like establishing a clear therapeutic frame, structure, safety, limits, maintaining a treatment alliance, right? Something that we know is vital for all treatments, is maybe one of the most important therapeutic factors. Having a team, a collaborative approach, and having a way to deal maybe through supervision with countertransference. Knowing what to focus on, especially when you bring in trauma, the notion of early on establishing safety, later on developing skills and early recovery skills, and latest finally getting into exposure and revisiting unpleasant memories. Dealing with all sorts of enactments and facilitating reintegration. Now, why do I put this up? This is preaching to the choir. You guys know this all, and I'm talking about meds. Because these are really core principles that apply to all therapeutic treatment of borderline patients. And, you know, if anything, there hasn't been enough of a focus on some of these elements in other sort of non-therapy frameworks for treating borderline personality disorder. And it means everything. You know, for me as a pharmacologist, to think about my patient's suicide attempt right as I went on vacation, if I come back and throw on some meds because they're depressed and don't have a way of, you know, understanding that, you know, I had to contain the patient's projections, you know, the patient's perceived abandonment, and make a phone call to the therapist to collaborate and to integrate a split between the treatment. My pharmacologist is leaving me because and you are, you know, staying because you, et cetera, then, you know, you are facilitating the kind of splits that the patient has developmentally had and has generated, you know, that self-fulfilling cycle in many other areas of their life. So this is enormously important in outpatient setting, in inpatient setting, in the pharmacological setting, though the focus of treatments is different.